Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. This month is Colon Cancer Awareness Month, and our guest today is Dr. Brian Smith of NVRH Hospital in St. Johnsbury. Welcome to the show.
Thank you. I appreciate the invitation.
Yeah, I try to have somebody come on at least if not every year, every other year, to talk about this topic, and kind of near and dear to my heart. I lost my wife to cancer going on 2 years ago. So she took all the steps necessary to not get it, or at least to catch it early. Didn't help her, but she and I were always big advocates of preventative health care. So I'm still moving forward. I should note I'm freshly off of spending a couple hours of my Valentine's Day getting a colon screening, and now I don't need it again for 10 years. So let's talk a little bit about colon screening and not colon cancer.
Yeah, you're absolutely right on in that colon cancer is a terrible problem that so many families, not only in our region, but all across the country and worldwide face. If you look at the incidence of cancers, colon cancer across the world is probably the third most common cancer overall. And certainly within the United States, it's still, unfortunately, one of the leading causes of cancer deaths, especially in young patients. So patients younger than 50 tend to experience death from colon cancer more often than any other thing. And interestingly, compared to many other types of cancers, it actually is one of the few that there, as you've already alluded to, some pretty good screening tests for. And there are a number of different varieties and options, but I would say majority of the time what we end up talking about is colonoscopy, with the major advantage of that procedure being that it is both diagnostic, that is, we can detect not only colon cancers, but probably more importantly, early forms or risk factors for colon cancers, such as polyps, and remove them, that is, take them out during the colonoscopy to help reduce the chances of colon cancer death. Yeah.
You know, the people talk like colon screening is just this horrible procedure. Now, maybe it is for some people, but for me, yeah, I've had it done twice. I've had it done at your hospital in St. Johnsbury, and I've also had it done in Marquette, Michigan, where I also live. And both, I'm not going to sit here and tell you they're pleasant experiences, but they're not unpleasant either. What do you have? Have you ever had one yourself?
I have not actually had a colonoscopy. No, I am 44 years old currently, and the most modern recommendation for low-risk individuals is to begin colon cancer screening at age 45. So I do have it within my future in the next 6 months or so.
So since you've done your share of them, it sounds like.
I sure have.
And so do you dread it yourself?
No, not at all. Honestly, it's probably one of the most rewarding parts of the career that I've chosen. You get to meet a lot of different people. You get to take them through what, as you've already alluded to, for a majority of people ends up being a relatively pleasant experience, and hopefully make a big meaningful difference in their overall health and well-being. You know, the big thing that I hear people complain about the most is the prep, and that is very understandable. For anybody who's not familiar, the prep is essentially a combination of different things to help clean out the colon so that we can see along the inside to make the appropriate diagnosis or do whatever kind of procedures we need during the course of the colonoscopy. And the reason that people don't like the prep is because the day before the procedure, oftentimes you spend quite a bit of time in the bathroom. Now, there's not much to do to reduce the chances of that. Unfortunately, it is a side effect of the procedure itself, let's say. But I will say that the prep experience seems to be better over the past decade or so. Generally speaking, the amount that you have to eat or drink the day before the procedure has gone down. So one of the things that people frequently complain about is feeling quite bloated from drinking quite a bit of fluid. But that has gotten a little better. And there are a number of different options that have become increasingly available to people to help minimize some of those unpleasant side effects. Yeah.
Well, let me tell you, I just barely got over the stomach bug. Probably you doctors would call it the norovirus or something that's going around. And I will take colon prep as a way to clean myself out any day versus a dose of the that little virus going around. And so, you know, there's also a lot of ads and a lot of talk about the less invasive way of having colon screening is, what is it, Cologuard or?
Cologuard is probably the most common or popular alternative treatment or test, let's say, that has become increasingly popular. And Cologuard essentially is an outpatient test. That is, you take it at the convenience of your home. You don't have to come into the hospital for it. And a stool sample is used to help try to identify signs of colon cancer or polyps. It has the convenience in that it can be done in the comfort of your own home. You do need a prescription to do it. And it is a good option for low-risk individuals who are otherwise nervous about undergoing a colonoscopy. The things that you should be mindful of if you're thinking about Cologuard as a testing option are that it is only diagnostic. That is, if you are found to have signs of tumors or polyps, then the recommendation would still be to undergo a procedure to remove those. So it can only tell you that things might be present. It can't actually remove them. And there is a slightly higher false positive rate for Cologuard compared to colonoscopy. That is, you may take the test and the test may indicate that something is abnormal when in fact everything is actually okay. So long as you're aware of that and the potential of needing an intervention afterwards, it is a very good option. It's very reasonable. It's also very sensitive at detecting the abnormalities. So the likelihood of having a problem that it misses is fairly low.
Oh, so in other words, it would still detect a non-cancerous polyp that could change into cancer?
It can, that is correct, yep.
Oh, so that's good to hear. Now, but that wouldn't, see, the first, my first procedure, a few years ago, they found one polyp, and that would have meant I wouldn't have been a candidate for Cologuard this time, would it?
You are correct. The current contraindications for Cologuard testing do include any history of polyps. So if you've ever been found to have a polyp in the past, most healthcare providers will not cover the cost of Cologuard testing, and the company does not recommend it as a screening test if you are not of the lowest risk category.
So, not to have you second guess my doctor, but I had one polyp. I think it was 8 years ago. I was supposed to go back in 5 years, but I was taking care of my wife, which isn't a good excuse. But I got a totally clean, perfect screening. So I'm 59. So does the 10-year return visit sound right?
It sounds correct, but in the interest of full disclosure, the timing, the optimal interval for screening is a bit of a moving target. So the traditional teaching was for patients that had types of polyps that were called non-adenomatous, that they would be considered lowest risk and that they should follow up in 10 years. And that's contingent upon some other medical conditions as well. So the relationship with your physician is the most important part in making the decision, both for you as for anyone else. But that is a recommendation that some agencies have, let's say, tweaked or changed a little bit. So the American Society of Gastroenterologists, as well as the American Society of Colon and Rectal Surgeons, are starting to lean towards shorter intervals. So currently, if you have a history of any adenomatous polyps, so that's a specific group or type of polyps, the recommendation is at the very latest a 5-year follow-up test. And in some cases, it's even as short as 3 years. But again, your relationship with your physician as an individual is probably the most important part in that decision making.
So at 59, and if I have one, because I'll probably have mine earlier, just because that's the way I want to do it. But if I waited until I was 69, how many more? If when I understand, there's a certain age you no longer recommend colon screening. Is that correct?
That is correct. The modern recommendations extend up to age 85. So screening colonoscopy should be considered in most individuals up to age 85. And that's also a little bit different than previous years where 75 was a more commonly referenced endpoint. I think the most important thing really is kind of your expectations of the test in terms of your quality of life and your meaningful outcomes for your own health. So I tell most of my patients, when you start to get into that age category, talk with your physician and have an honest discussion with yourself about how you feel and what you expect. For patients in really good health with minimal comorbidities or other medical problems that they need to juggle, it may be very well reasonable to screen them up through age 85. And for others who have more complex medical issues or who have had really challenging experiences in the past, that upper recommendation may be a little different.
Yeah, I was talking to a friend of mine who's going to be 80, and I guess the doctor was recommending, well, you don't really need to take them. You don't need to have one anymore. But she said in her family, there's a good number of people, including her parents, who near the 100-year-old mark. So she's figuring, she's in great health. Her parents lived to be almost 100. So she figures she wants it one more time.
Yeah, we're absolutely seeing people in better health through later ages in life. And in some regards, that speaks to not only the importance of colonoscopies, but other forms of general and preventative health maintenance. And hopefully it's all those screening colonoscopies that we do that get patients through those years and get them up to those older years.
I'm going to tell you, I find that over the years I've written about being a writer. I've written actually a number of times about colon screenings and the importance of it, including documenting my own. I find that when people share their stories, particularly tough stories of people battling colon cancer, it actually gets people off the couch to the phone and contacting their doctors. Because, even though it's no big deal, it's not something somebody looks forward to, but, I just think people ought to just look at it as from watching a person die of cancer. I will say dying of cancer is far, far more uncomfortable than just the prep you have for the screening and the screening itself. Cancer kind of sucks, to put it bluntly.
Yeah, I think you make an excellent point. The screening colonoscopy, it certainly has some unpleasantries to it, and the anxiety associated with maybe the first time in particular is important to talk about and discuss. But boy, the preventative measure and saving those lives of patients who had otherwise worrisome polyps that had the opportunity to be removed makes all the difference in the world. Of all the different screening tests that we have for different varieties of cancers, so things like CAT scans of the lungs to look for lung cancers or mammograms to look for breast cancer, colonoscopy really in the big scientific literature has probably been the most impactful test in terms of reducing cancer mortality compared to all the others. So taking advantage of that really is paramount, and taking care of yourself and your family.
Right. Okay, so we've talked quite a bit about the screening, but when should people start getting screened? You know, because I know that's moved a bit.
Yep. That's a great question. For low-risk individuals, most professionals recommend initiating screening colonoscopy at age 45. And then patients who would be considered in the non-low risk category, depends a little bit on what the risk factors are. So for instance, there are some hereditary familial colon cancers, and the screening of those individuals would start earlier. And for patients with first degree relatives who have colon cancer, we typically recommend that they screen either at age 45 or 10 years before the diagnosis of the first degree relative. So for instance, if dad had colon cancer that was diagnosed at age 40, then the child should undergo screening colonoscopy at age 30.
So why is, from what I understand, colon cancer is starting to affect people at younger ages? And if that's the case, why?
You are correct in that the incident rate of colon cancer has gone up in younger patients over the past decade or so. We don't have a great understanding of why that is. We know that there are certainly things that have been linked to and or associated with colon cancer. So tobacco use, alcohol consumption, consumption of processed meats, and reduced consumption of healthy fruits and vegetables are all things that are pretty intimately linked to the development of colon cancer. Now, as a causative pathway, that is exactly what's happening when an individual smokes a cigarette that ends up resulting in colon cancer, is still poorly understood. I think it's going to take a lot more research in terms of lifestyle and population genetics and things like that to help us better understand it. But you're right in that younger people are being diagnosed with colon cancer more frequently, and that has impacted the screening age that we talked about, that shift downward from age 50, which was traditional, down to age 45.
Is there any, I understand that by the time you actually exhibit signs of colon cancer, that's, you have a battle already on your hands. But what are the signs that you might have it, or you might have something leading up to it?
That's a great question, and you're right in that unfortunately there are not great clinical signs that you may have an evolving colon cancer. So it would be pretty hard for you to go and get a routine checkup and for someone to put a stethoscope on your belly and say, yeah, it sounds like you have colon cancer in there, or for you to offer some symptom where that might spark someone saying, boy, that sounds like colon cancer. Typically, polyps, when we detect them, are quite small, only a few millimeters in size. So you would never feel that growing inside. And by the time that turns into a colon cancer, it may still be quite small before you would ever experience any symptoms. I'll say in the office, I'm always a little bit interested when I hear about things like unintentional weight loss or really particular gastrointestinal symptoms like bleeding during bowel movements and things like that. Unfortunately, while those things may occur with colon cancer, they also occur for a lot of other reasons. Hemorrhoids can cause bleeding that is not problematic at all. So there just are not a lot of great clinical signs that a colon cancer may be starting. And that again kind of underscores the importance of considering getting screened before you have any symptoms at all. That's probably the only way that we're going to make headway in terms of detecting colon cancers earlier.
Okay. That there's many jobs I wouldn't want to do, but being a doctor is one of them. Is especially, you're a surgeon, I assume.
That's correct.
And are you the one who I can't recall. Yeah, I talked to the surgeon after I got done, but must be hard to tell people that you really rock their world when you have to tell them they have cancer.
Yeah, it's a hard part of the job. And like all other jobs, I suppose, there are ups and downs all along the way. And I think, being sensitive to the situation that the patient may find themselves in, I always try to remind them more than anything, getting information is probably the most important and powerful part. So, in that regards, sharing it and being honest with one another, both in terms of how they're feeling or the information that I have discovered or know. It's the exchange of those things that help build the relationship that make it a little easier. But you're right in that there are challenges to the job, and yeah, it's true.
Yeah. As I said, I love to talk about the importance of this because I have, as I said, I've written about it. I've known many people who've died with cancer. I hate personally, to tell you the truth is I'm sitting here, maybe I'm a bit of a hypocrite, but I don't think so. I think I'm being honest, is my general nature would be, if it isn't broke, don't fix it. And thus, why would I want to go for a screening of something that probably isn't broke, or at least it doesn't bother me? And if I hadn't had a wife, and I think men a lot of times, I think the good thing about having a wife is they're sometimes the ones who make you do the right thing. But so I go against my nature of, just because I take very good care of myself. I run, I hike. And so I could sit back very easily and say, I'm doing what I'm doing. But no, I don't. I force myself for those screenings.
Well, I think I can understand the sentiment of, if it's not broken, don't fix it. In many regards, that applies to some of my philosophy in life too. But I would also maybe try to reframe it a little bit in the sense that it may not need to be fixed, but boy, taking care of it is certainly important, and hopefully keeps it from breaking a lot longer than it may have otherwise. So I guess I would tend to try to think of screening colonoscopies as a maintenance type issue rather than a repair. The simple truth is, if you end up needing me to repair it, you're going to regret that you didn't take care of it for much better all those times. And boy, it's, again, there's no obvious way to make it any easier what you've been through in your experience, and a lot of my patients have been through. But boy, what a wonderful gift to be left with, of that reminder to take care of ourselves and each other while we're still here, and some important lessons that we learned from the unfortunate experiences of people that we love. So
I will tell you, when I went for my colon screening, I knew I had to do it, but it was probably one of the hardest things I did, because I had, it forced me to really go outside my comfort zone too, because when you lose a person to cancer, or anything, there's a lot of residual effects on you.
Sure.
And I just going there, even though I was fairly certain it was going to come out fine, but to be screened for cancer, just a screening after losing my wife to cancer, I will say, I told them right up front. I said, okay, I'm going to be coming, but let me tell you a little bit about myself. And I was honest. I said, I'm cool with the procedure, but I lost my wife to cancer, so I might be a bag in there. And they were super.
Yeah, I think compliments to you for having the courage to disclose that. And boy, it makes it a better experience for everyone overall when we understand the things that each other have been through, right? And it's not necessarily the procedure that makes somebody nervous. It's the fact that, boy, this hits close to home, right? Someone else was in these shoes not very long ago, and it didn't go very well. And now I find myself on a similar pathway. I sure hope my outcome is different, but just that process of it can really provoke quite a bit of anxiety. And the truth is, the more that you talk about that and disclose it or ask questions about it, what we find too is there's a lot of ways to treat those things. So, you know, I spend a lot of my time thinking about, will the patient tolerate the prep? Or what kind of complications do I need to be mindful of during the technical parts of doing the procedure? And sometimes none of that really matters in the big picture. It's the patient's nervous about the diagnosis. So, you know, help get them through that anxious part of it, and the whole thing is better and easier for everybody.
I will tell you, when I had my screening done like 8 years ago at your hospital, it was a totally different experience, because I'm sure you doctors get to hear it all, especially for people using humor to try to relax themselves. I have a feeling the surgeon back then heard every bad butt joke there was.
There are quite a bit of jokes that go around the old colonoscopy procedure. That is true.
You know what, though? In all honesty, I went into this recent one with a totally. I could not find myself. I didn't mind it, but I could not laugh after losing my wife to cancer. So, all right, we're almost done, but I've got to ask you this question. When I had my procedure done at NVRH, this didn't happen. When I got this procedure done, the doctor or the nurse then hands me a photo of the inside of my colon. Do you give out colon shots?
I do. I try to give all of my patients as many photographs as I can reasonably take during the procedure.
And where am I supposed to hang it? Is that a bathroom photo?
Yeah, it's and it's an interesting part to find out.
I thought it was hilarious when I got it. I said to myself, and I said later, I said, okay, where will this picture look the best? And somebody said, well, makes sense. Put it in the bathroom. So, okay, we only have a couple more minutes left. What more would you like to say about this topic?
Well, actually, you reminded me there, in the timing of your colonoscopies, I'll just offer kind of as another little insider piece of suggestion to anybody that may be nervous about it, is that a lot is better now compared to some of the older days. Typically, the medications that we use are more comfortable for patients. The experience is more pleasant. We have enough volume that we try to streamline it so patients aren't waiting around. So a lot of the things that I think have traditionally been kind of unsettling with colonoscopy are getting better and continue to improve. So even in 8 years, I'm certain that the medicine that we use to get patients off to sleep now is different. I think they sleep better. They wake up with less nausea maybe, or abdominal discomfort, and it continues to get better. So I would caution some of the younger folks that might be nervous about it, hearing from patients that underwent procedures years and years and years ago, that it may not be the same as some of the stories that they've heard.
Absolutely. It's between 8 years, and it was different hospitals, but I could feel some of the stuff going on 8 years ago, just a little. It was like, I think they call it twilight in you.
That's very common.
And but with this one, I remember asking the one who puts you to sleep. I said, "Have you started it yet?" And they said yes. And they said, "You should start feeling it." Next thing I know, I'm being woken up and I loved it. That was a great sleep. So, all right, well, it looks like our time is up, and it was great having you on. But anytime you want to come on to talk about anything, I welcome you on. I do think preventative health care is key. I think we can rely on doctors to help try to get us better, but I think we need to rely on ourselves to keep us keep us in good as shape as possible.
I appreciate the invitation, Scott. It was fun talking to you. And you just reminded me we're coming up on St. Patrick's Day. I look forward to hearing about a few colonoscopy jokes, because that one usually shows up this time of year.
Okay, thanks for coming on.
My pleasure, Scott. Take care.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.